It was a peaceful morning at Snow Pass, Upper Bundi in the Madang province, as a team of volunteers prepared medical kits and supplies to begin a 207-kilometer medical patrol. These are members of the Kumura Foundation, a community-based organization in the Bundi district. On the 13th of December 2021, they embarked on the Foundation's Travel to Change program to deliver health services to rural communities that do not have access to clinics and hospitals. The team consisted of medical officers from the Chimbu Provincial Health Authority, local community health worker trainees, and the Kumura Foundation track team. After the official launching of the program at Snow Pass, the team set up the first clinic.
During the clinic, we refer two patients. One 6-month-old baby, and the other one is a 2 months old. So we see that they are having severe pneumonia, and after a referral, the Kumura Foundation ambulance went straight to the nearest hospital in the Gambog Health Center to save their life. They went straight, and then they went through the oxygen.
Being a community bordering Madang and the Chimbu province, access to basic services like health and education is a challenge, along with bad road links. 21 out of 22 aid posts in the rural Bundi LLG were closed down, forcing locals to walk long distances to get treatment.
Road condition right. Na place no wat sick. Mi place aputimol sick man merilo stranger lo bus materials na place aksimol golo Bundi sick. Mi place aksimol golo Ramu Nicole company help mi place na place aputimol lokar aksimol golo Valium sample time plakar mol kamanta plus no pass Vincent Kumura help mi place na aksimi place la ambulance na godan lo kundia sick. Now planting plan place alright. Na gaman no bisi lompla tumaslo dislakain ol gaman services sosem ausik na ol sila lik ya ol no bisi tumas lompla na planti life lose lo dislakain road.
In order to bring these medical services, basic health services to the people, we would conduct medical patrols because they couldn't get to the nearest health facility. In here, we have on average about 6 to 8 mothers would die from delivery complications every year in Bundi. And then we have 80% of our children, ages like little kids to 14, are not being immunized. So there is definitely a huge healthcare need here for our next generation. So.
Albert so cream, Rebecca.
The foundation set up rural clinics in 7 villages starting at Snow Pass, then continued to the Bundi station, to Numba, Tawia, Safi, Pendiva and Karaini. Over 1,500 patients were seen at these rural clinics during the Travel to Change medical patrol. 2 of the most common cases seen were arthritis and hernia, which is caused by the locals' lifestyle of carrying heavy items and mountain climbing. Severe cases were referred to the Chimbu and Madang provincial hospitals.
From the total of 1,500 patients we saw, most of them are arthritis patients. And the second lot we saw are those that are work-related, and due to the mountainous and long distance and the type of work they do, they all come with complaints of back pain and knee pain. Remaining, the other 10% are from sexually transmitted infections, pelvic inflammatory diseases, STIs. The other 10% are from ones with chest infections. The others are the ones not mentioned. So we have covered so many, in a space of short time, we covered so many illnesses, so many diseases. Some of them need referrals, and so we refer them.
The foundation has been conducting these medical patrols since 2017. While it is one of the programs under the Rural Health Focus, it is also the foundation's major fundraising event. Director Vincent Kumura said because of their rural base, it is difficult to host fundraising dinners, hence through the Travel to Change program, they give back to the communities and raise funds through the support from organizations.
So we thought we might just go on with a natural strength, like we trek a lot and we live in the mountains, so walking is our daily activity. So we decided to be a little creative and toss a spin on that. And mostly it comes like a hobby to us to track anyway. So we want to carry medical bags into remote communities and serve the people where they are and make a difference. Most of Papua New Guinea is unreached. Most remote areas of Papua New Guinea is unreached, even by airplane or by vehicles or motorboat. You have to track by foot to reach the unreached people. So instead of just walking, we want to bring medical doctors or volunteers to go there and treat people where they are. So I think in the process of doing so, the idea of raising funds to sustain our noble mission is a good one, because we cannot pretend to come out to town and city and put a big barbecue dinner or put a hotel fundraising dinner. It's gonna be a challenge for us.
The funds raised will go towards the foundation's operations in their rural health, education and community-focused programs this year. One of their programs is the school excursions for orphans and disadvantaged children taken care of by the foundation. In 2020, a group of school kids were brought to Goroka to expose them to life beyond the villages. The children ended up touring an Air Niugini plane at the Goroka airport and even met the Prime Minister James Marape. Much of the support for the foundation's operations has been given by the Sir Brian Bell Foundation over the years. This includes an ambulance that was donated to help transport patients to the nearest health centers. They've also been supported by Sir Peter Bata through the Madang Resort. Last year, Mapai Transport came on board to support the foundation with logistics for the Travel to Change program.
And the Chimbu Provincial Health Authority for supporting us with a much-needed medical team and also the medical supplies to have this campaign done successfully.
For these volunteers, it is about bringing services and giving a hope to their communities amidst years of neglect by successive governments.